Welcome to Treasure Coast Community Health, with 7 locations to serve you better. We have a dedicated staff. And now, here's your host, CEO Vicki Soule.
Good afternoon, and welcome to Community Conversations. You know, Treasure Coast Community Health offers primary care, medical, dental, behavioral health, and we've continued that ever since and before the COVID virus struck. We are currently doing testing, and we do have a very dedicated staff. They are doing everything in their power to stop the transmissions of the COVID virus. And of course, that is ever present on everyone's mind. But I'm going to break with tradition a little bit during this tense time and tell you about something else. I've invited a guest who's very active in our community. Many of you will recognize her, not because she is a leader in her organization, but she is an informal leader, as we call them, that does lots of wonderful work within and for our community. So today I'd like to welcome Emily Wilcox. She works at the Senior Resources, but she is also a huge part of a new project under the guidance of Randy Riley and Abby Walters, both the Senior Collaborative and the IRC Livability Community Program. And so we're going to spend our next 20-30 minutes talking with Emily about what that is and what that forecasts for our community, because we are ever hopeful that COVID will be a thing of the past very shortly, and we can go back to our normal advancing lives. So welcome, Emily.
Thank you, Vicki. I'm so happy to be here today and to share some information with you about the Senior Collaborative and livability.
Well, the Senior Collaborative seems like it would be an offshoot of the Senior Resource Association. But as a board member myself, I know that that's not so. The Senior Collaborative actually was started well over a year and a half ago. And while Karen Deagle is an integral part of it, as you are now, there are other board members that sit on that represent different aspects of the community. Can you tell us a little bit about their mission?
Yes, I can. So their mission is to improve the quality of life for all Indian River County seniors through a community collaboration involving multiple different service providers, funders, and advocates, and ultimately to be a resource as the one-stop place to go for information to connect you to all of those available resources in the community.
And I'm not sure what the age guidelines are within the Senior Resource Association for seniors, but certainly AARP has encouraged all of us to think more about seniors starting around the age of 50, 55, 60, as opposed to what used to be the magic number of 65, correct?
Correct.
But seniors don't live always by themselves, nor do they always seek out resources from the Senior Resource Association. So a splinter of, that's not the right word, part of recognizing that is the livability portion of our community, because that's really what's underneath all of this initiative of collaboration is how do we make our community more livable now and into the future, not just for those in their 40s and 50s who will become seniors, but the parents and the children that live within our community now. We would like to see them stay for the next 50, 60, or 80 years because this is such a livable community. So IRC Livable Community is an offshoot of the Senior Collaborative, and that's really where you have gotten very involved.
Yes, so I am a core team member of the Indian River County Livability, and with that, our mission is to expand the livability for all people of all ages in Indian River County to create a community that is safe and secure and that is supportive through features and services that ultimately enhance the quality of life for all residents.
Now, we didn't just gather a bunch of people around a bar top and say, let's have a project, right? This livability thing has deep roots across the United States already.
Yes, through AARP, this is a function where we were designated So we had to meet certain qualifications already and then apply. And then with that, then we'll focus on these 8 key features in our community to expand on being livable and really just a great place to live ultimately for all ages.
And part of that application and processing by AARP involved ensuring that there was governmental leadership as well as nonprofit and for-profit agreement that this was a good initiative, correct?
Yes, actually, our county representatives did have to request for this, and then they designated the Senior Collaborative as the organization that would spearhead it. Okay. So we're working together with our county commissioners and then looking at those key features. So it's a pretty big initiative.
So the 8 factors that are a part of consideration, can you tell us a little bit more about those? It really does have a structure.
Yes, so we look
established.
at the outdoor spaces and buildings, which would include your parks and your public spaces, as well as the transportation that's provided and available in the community, the different housing, as well as social participation, so the events, your arts and culture, and everything that you can do within our community. Respect and social inclusion, so we're looking at diversity and that everybody is included in what is offered in our social participation. As well as work and civic engagement. Are there great job opportunities and a way to advance in your careers, and how are we engaged civically, as well as the communication and information. So how are we putting out all this information? How do people know about where to go and what to do and how to get involved in the community, as well as community and health services like Treasure Coast Community Health, and all the other great community services that are available in the community.
Well, particularly as you think about seniors, just to dwell on that for just a moment, we're certainly talking about more than primary care. We're talking about assisted living. We're talking about home care. We may even be talking about hospice. So those are an expansion of what we already see from birth up to the being a point of a senior. And all of those folks are involved in this initiative. So I'm going to go back to the very first one that you mentioned. And that is, remind me?
The outdoor spaces and buildings.
And I came back to that specifically because it's been very interesting to have the involvement of Phil from the county in terms of the urban planning, looking at the 5-year plan, and then kind of understanding that and maybe having the opportunity to tweak it a little bit. And so all of those things, and we'll talk more about each of those elements, but all of those things not only lead us back to the Senior Collaborative in terms of having a group of people that can disseminate information through Randy Riley's organization and leadership, but also allowing us then through a survey of individuals to say, what's important to you? What do you think we have? What would you like us to see? How does it affect you? And so, again, starting right at the outdoor spaces, is it sidewalks? Is it bicycle paths? Going on to number 2, is it transportation? And so those surveys are just now starting to be released, correct?
Correct. So what we've done is we've designed a survey based around these 8 key features, and we want to ask everyone of all ages their feedback as to what's great in our community, what needs improvement, if there's specific things that we can do to improve the quality of life for all residents. So we're looking at things that whatever is great for an 8-year-old would also be great for an 80-year-old. And when you talk about parks and recreation and all the different opportunities that there are to make sure that they're accessible for everyone. So we have wonderful beaches in Indian River County.
We do.
And one thing that we can assess and do is say, how great is our handicap accessible ability to those beaches? And then, through the survey, we could find out how many people actually need that, and then ways that we can implement in making a change to make it even better.
So it sort of sounds like the community needs assessment or the senior assessment that was done 4 or 5 years ago. Do you see some subtle differences in it, though?
Specifically because we're looking for examples and ways that we can improve. I think there are some similarities as we've found out what there are needs for, but then this is assessing each specific thing separately.
Okay. And it is more neighborhood oriented, correct?
Yes. So we ask, there's a breakdown of different areas in our community. So then that way we can really look at what community needs what more, and then offer those through really assessing all of the information. And, this is just a quick project. This is the long-term plan that will help us to slowly make these improvements within our community. And it might, one community might be have more accessibility to healthcare resources while there's a shortage in another. And so when we look at that information, then we can see what we need to focus on first.
Good plan. So I'm going to stop us right here just for a couple of minutes so that we can hear a word from our sponsors. And then when we come back, we'll talk about those 8 different parameters and how we can use this data to help prioritize and how other communities have done that. Thank you. You're welcome.
9, 8.
Why did the countdown stop? Because it's the countdown to Buzz TV channel 1098, Comcast Xfinity, and it's here. Local content for Sebastian Vero and Fort Pierce. Tune in for local info, happenings, and fun, including all the great Planet Vero TV shows from 8 to 10 a.m. and p.m. Dial in channel 1098 for Buzz TV on your Comcast Xfinity box and discover what the buzz is all about.
Riverside Theater presents The Comedy Zone, one of the largest comedy club networks in America. The Comedy Zone showcases some of the funniest comedians in the country. This weekend, Riverside Theater is the place for uproarious adult stand-up comedy. Don't miss the fun this Friday and Saturday at 7:30 and 9:30 p.m. Call 231-6990 or go to riversidetheater.com. The Comedy Zone this weekend at Riverside Theater, sponsored by Premier Beverage and Spring Hill Suites by Marriott. Riverside Theater presents The Comedy Zone.
We moved on up. Planet Vero Radio. Great talk for the Treasure Coast can now be heard on 101.7 FM WCZR and 103.7 FM WQOL. Listen for our many local specialty shows from Friday through Sunday on these regional FM stations. Or listen at your leisure by finding Planet Vero Radio on many podcast platforms, including Spreaker. And thank you for continuing to support Planet Vero's local talk and entertainment format. We're here for you, Treasure Coast.
Hello, I'm Leslie Swan, Supervisor of Elections for Indian River County. The August 18th primary election is just weeks away, and I want you to be election ready. Florida runs closed primary elections. This means in partisan races, you may only vote for candidates of the party in which you are registered. Every registered voter is eligible to vote in nonpartisan contests, universal primary contests, and referendums. The last day to register or change your party affiliation is July 20th. Let your voice be heard. Vote.
Hi, I'm Vicki Soule, CEO of Treasure Coast Community Health. Treasure Coast Community Health has been serving Indian River County for 25 years. How did we get here? It took a commitment to you to provide you with the most affordable, high-quality, integrated network of healthcare available anywhere. It took board-certified doctors and dentists and a dedicated staff to ensure that you receive the best possible care. It took more locations to meet the need, and now TCCH has 7 locations, with the latest one conveniently located down the street from Cleveland Clinic Indian River Hospital. Our services are available to everyone, whether insured or not. And at TCCH, no one gets turned away due to an inability to pay. We rely on donations from generous benefactors to continue our much-needed work. We accept Medicare, Medicaid, and almost all insurances. Call us at 772-257-8224 or visit us at tcchinc.org. And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health. And each week we look for guests that can speak to something relevant. And so although Emily Wilcox and I are taking a social distance apart from each other, we are taking a mental break from the COVID and talking about something else that started before COVID and will go on I anticipate much after we have figured out this whole virus thing. And that is a project that has been initiated called the Senior Collaborative. It's over a year old, and it's being led by Randy Riley. And Randy and his board of directors got us very engaged in something called IRC Livability, as Emily said earlier. If something is good for an 8-year-old, it's also good for an 80-year-old. And so we're really taking a look at the livability of Indian River County. This is work that was started by the AARP, according to Emily. And we're talking about the structure in place for livable communities. And of course, we all think that we live in paradise. But will our next generation or two feel the same way? What kinds of planning should we do now as we see our population aging that will enhance living for our younger set so that they won't feel that Orlando or Tampa is a more livable place for generations of people and their families? Because truly, by the time you get to be senior sized, you've acquired friends and family, and you want to have a great place to live in and around with those folks. So, Emily, we talked about some of the 8 components, outdoor spaces and transportation, which sort of go neck and neck in some way. If you don't have transportation, you're probably going to spend more time in your own local area. And so those green spaces, the parks, the accessibility to them, and the conveniences of them. As we get a little bit older, we might get a little more active because we're not working 50 or 60 hours a week. Well, at least that's my dream. But on the other hand, we may have had some accidental injuries or chronic health conditions that limit our participation, and those could be enhanced by other things. I think you were talking about some swings for seniors so that they can enjoy the outdoor spaces.
Yeah, so I was just mentioning, once we have the results from the survey of what's needed in our community, that we can apply for some special grants for specific projects, and some examples of others that have joined the livable communities, because there are hundreds across the nation, and I believe around 50 or so in the state of Florida that are part of the network. Okay. They've applied for special projects, and for example, we could put in a swing at a bus stop rather than your traditional bench, and this is great because it allows you to sit and rest, but it's different, something different, and we're really just hoping to get as many results possible. So if you're interested and available to take 10 minutes of your time to participate in our survey, you can visit our website, the ircsc.org. That's the Senior Collaborative's website. And then the link to the survey is available there. We also have a Facebook page as well if you were to search Senior Collaborative, and you'll find the livability survey. And it takes about 10 minutes, and we really just appreciate all the feedback so we can start to see what changes we would like in our community and where.
Yeah, I took the survey actually this past weekend. And even though I had been a part of the team that talked about all the elements and kind of looked at the original survey that we had gotten from someplace, and then probably AARP, since they're a prime leader in this. And still, when I sat down to do it, it was very challenging. It doesn't take long if you're a very decisive person, but it is set in such a way that it encourages you to think about and add your own comments to the answers to the questions. And that's really what we're looking for. It's not just a yes, no, or I'm of this age, or yes, I own my own home, which are some of the simpler questions I could roll through. But, which of these things that we've listed above that you either have or would like to have or participate in is most important to you? And so I would encourage you to sit there and think about it, because that's really the essence of how the decisions are going to be made, is weighing all of those different factors, I think, as opposed to a straight tabulation, which many of our needs assessments are kind of a yes, no, check the box and move on very quickly.
Yes, so we do have open-ended questions in each of those 8 categories, and that's because someone from my generation who might be mainly concerned about childcare and those resources in the community, my responses and results would be much different than my grandmother, who would be looking for specific doctors and healthcare professionals or activities to do for seniors, and I'm looking for activities to do for children. And so we have each of those segments and an open-ended question that allow you to leave your suggestions, your comments, your feedback. What are your needs in that category? And then we're really going to spend time analyzing those results so that way we do know where to focus the community's effort and energy, because the livability community has a core group of multiple different people that are helping with generating the survey, reviewing the results, and then implementing a plan. And we're really looking at the big picture, so like a 5-year plan. And although we're already considered livable, and this is a great community to be in, we want to be the place where when you're born here, you grew up here, you don't want to leave here, you want to raise your family here, and then for generations, everything is here for you, and you don't have to look elsewhere. And so we're trying to make sure we really analyze all those different 8 components for all ages.
So we've talked about 2 of them, transportation and outdoor spaces. What's numbers 3 and 4? Not that they have any particular order, but...
So housing and then social participation are the next 2. And housing, we know, is always detrimental to every community, and that there's never enough affordable housing. And so
that certainly will not be a solo project of the Senior Collaborative.
Definitely not. We will be collaborating with lots of community organizations when we look at those results and how we can improve them.
But social inclusion is an interesting one, because we have such a wide variety of activity levels of our population. How do we include people that are not necessarily club people, or, I'm at the tennis
or into
courts.
The arts, or
yeah, exactly.
I only like outdoor, I only like indoor.
Right.
So how do we make sure that there's opportunities, for the disabled and for the very active, and so
that feedback's really important, because not all of us were born and raised here, and some of us have had experiences in other areas. There is a town in Florida that I'm familiar with that a group of parents got together and they made this huge wooden structure, and it was castle turrets and rope swings and things that really engaged the kids from 3 to 18, really, because it had, again, such a variety of things that they could do in it. And yet it was difficult to get to. They didn't think about that. So the grandparents didn't have a place to sit and watch their little charges during the day. But again, you start with one thing, you learn from it, and then you move on. So how long is this survey going to be able to go on, Emily?
Right now, we have it accessible. We're hoping to start to review the results come this October.
Okay.
So depending on how much feedback we get, we're thinking about closing it near the end of October so we could start to analyze all the data. But right now, it's accessible. And then once we have a definitive deadline date, right now we've just kind of set it as until October.
Okay. And the original thought before COVID was that we would be able to gather groups of people, explain it to them, and do a lot of focus group discussion. Obviously, that has had to be postponed. So we're going to be relying on people to share the survey, share the information about the livable community through their own Facebook pages.
Yes, so we have sent out a constant contact email that can be shared within your own circle or network, and then we will have it on Facebook as well as on the website.
Okay.
And we do plan still to have those focus groups. They might look a little bit different than in person, but really, we're going to get different data when we sit and talk one-on-one like you and I did today than
Emily,
we would
could
from
talk
the
about
computer.
this for hours and hours, but I think our time is coming to an end. So let's say thanks to you, both you and our listening audience. And remember, ircsc.org is where you can connect to this survey and share it with your friends. Thanks again, Emily.
Thank you, Vicki.